All right, perfect. So currently I work in pediatric dentistry and I worked in general dentistry before. I think my route for dentistry is more non-traditional than others, so you'll know about it in the presentation. And it's going to give you what dentistry is like for those of you who aren't familiar with dentistry at all. Okay, so I think we're gonna have a question and answer session at the very end, and here it is, right on the dot, 6 o'clock in California, 9 o'clock in New York on the East Coast. Okay, again, so currently I work in pediatric dentistry. I was featured on TV in a few magazines, and I really like to. For me, I love it. Every day feels like it's not work for me. Today, I saw about 75 to 80 patients today. In pediatrics, our assistants do most of the work, and again, for me, it's just for pediatrics, it's like most more simplified than general dentistry. So my journey to dentistry was more the non-traditional route. I was born in the Philippines, but I moved to California when I was 3, so I pretty much grew up here. But then I went to dental school in the Philippines, and then I went to a 2 year program in advanced standing in Chicago. So pretty much I've been working as a general dentist in 2016. I currently work in pediatrics more recently in 2022. But work experience prior to dental school in the United States, I was a multi-specialty assistant. I did oral surgery, endo, pediatrics, and periodontics, and that kind of got me like a wide range of what type of dentistry I wanted to do when I did practice. And also, before I started dental school in the United States, I was a practice manager, a regional manager, and I was a business development director as well. So it got me, I worked for some of the biggest dental service organizations, like Pacific Dental's one, then some smaller ones, like now the company I work for, Children's Choice and Kids Care. So I got to learn the ins and outs of dentistry. And I think that actually, for those who are applying, some of the dental experience is something they actually looked at, and they prefer. I know a lot of my classmates in the traditional 4 year program, they were managers, they were RDAs, they were DAs, and just because you're going to know the terminology better, you're going to know the software, you're going to know how to work with patients. I know during interviews, it's more favor, compared to when you're interviewing. Of course, it's overall profile as well. So activities and university, again, academics, number one, I was in music, so I sing songs about dentistry. If you follow me on Instagram, community service, I worked for the Pediatric Dental Society, ADEA, American Dental Education Association. I was a national district commissioner for District 7. I also was the marketing director at UIC, and partying. I guess this is part of someone else's post, and I kind of just like, oh yeah, we do the same thing. So in dental school, there's going to be a lot of invitations for free food and free drinks wherever you are, because they're trying to lure you in, because they know you're going to make a good amount of money after you graduate. So a lot of these people try to get you to join their, join their little parties there. Make sure it can get overwhelming very fast. So this is some pictures of me and my classmates, or some of my teachers in dental school. I think I was a big nerd because I was friends with more of my professors than I was my own classmates sometimes. So again, here's more dental school life. If those who aren't in dental school yet, we're looking to get in dental school. A lot of lab work, a lot of late hours, sometimes depending on the school you choose. So advice for those who are applying. Again, I don't know, those who reached out to me, I actually ran a consulting company. I still do it, occasionally help people get into dental school. So, and I work with some of the admissions advisors for different universities still now, so I still reach out to them and kind of know what the latest trends are for admissions. So build your profile, even if you're an advanced standing student, or if you're going to be a traditional 4 year student. I know they look highly upon a wide range of experiences, volunteer work, community service. So I remember the admissions at USC and UIC and a few other colleges. They talked about the 3 things they look for are your community service, your leadership, and your work experience. Of course, aside from academics, but of course you can't, fail a lot of classes. But I know some students who actually did have a lower GPA and did get like a D in a class before, or like just a C. But then the questions they're going to ask is, why did you get this grade? So make sure you have to be able to explain why you got that grade, okay? Prepare for application mentally. My advice for students is research the schools that you want to attend. I make a list of 10. I know some students who apply for a ton of schools, right? If you have a chance to visit it or talk to, I know they have every year, these schools have you can visit the universities, you can do a virtual shadowing session, a virtual tour of the school. If you live near a school, it's going to help if you, become a research assistant at the dental university. And get to know why you want to attend each school, because advice for your interviews, I do a lot of interview coaching. is they're going to ask us, why do you want to go to this university? They want to know. That's going to help your admission, because they're going to kind of guess if are we a top choice for your school, or is this candidate going to be like the bottom 10? You know, do they really want to go here or not? So you have to be very convincing. So when I worked in general dentistry, I did a lot of oral surgery. I did implants. I did bone grafts. I did what's it called? Yeah, a lot of surgical, a lot of dentures. Sometimes you kind of end up where you end up. After graduating dental school in Chicago, my first job was at this like kind of like mini corporate. It was like 10 offices around Chicago, and they did like, it's just their demographic. It's a lot of surgical extractions, a lot of simple extractions, and then say like either immediate dentures, depending on the case, or a lot of like fractures. It was low socioeconomic status. So again, my advice for anyone becoming a dentist is get your experience. And this one was a lot of experience, and I had great mentorship too. So they taught me a lot of techniques, and I felt like the more patients you see, like I had some classmates, they saw 6 patients a day. They were doing PPO, fee for service. I sometimes saw 20 plus patients a day. And I had like working with 1 or 2 other doctors those days too. So they kind of, an older doctor with 10, 20 years experience gives you advice on certain cases. You can ask them, because sometimes, dental school, sometimes you go, what was that case again? So that's what it is. So I'll go over general dentistry and pediatric dentistry. So general dentistry, again, depending on what type of office, there's Medicaid, fee for service, there's PPO, fee for service, or Medicaid, or a mixture of both. There's the DSO type, or the private practice model. I think in the United States, we're moving towards more small DSOs nowadays. I feel like it's becoming, after dental school, a lot of these smaller practices want someone like 2, 3, 4, 5 years experience, what I'm seeing now. And if people are looking for pay, I mean, I know I've seen it go from $600 to $1,000 day guarantee, from 20 to 35 to even 40% on production, depending again where you live. So my typical day in pediatric dentistry, it's more fast-paced and quick. I personally, I became the top producing dentist in my company. So I see 70 plus patients a day, sometimes more. Again, less complex, lower cost procedures. It's more about patient management and managing the parents. Quick decision making can be physically, mentally draining. I mean, yeah. So again, like a lot of kids, since their mouths are smaller, they're moving around a lot. You're not just in one fixed position. You got to kind of be ready to be mindful of their movement. So if you're thinking about pediatrics, I love it personally. There's a lack of providers all across the United States. So if you want to do pediatrics, you'll be high in demand all over California. And I know people always ask this in the question and answer, how much you make and stuff. So, I mean, fresh out of school in UIC, I did over 500K a year. Now I'm doing really close to double that now, my take home pay. So it's just, you got to love what you do though. Because I know some doctors here, they don't last. Even if you get paid pretty well, they complain a lot. They're stressed out. For me, I feel like I can work after work. This is me after a long day. This is me after a long day, and I still have energy to do more, So if you're working pediatrics, what type of cases are you presented with? And the question I get asked like almost every day is, when will my child get their adult teeth? Why are they grinding? A lot of accidents, especially after, New Year's and Christmas, a lot of broken teeth, a lot of abscesses, because kids are eating more than 2, 3 times a day. So that's what we see a lot of in pediatrics. And I don't have a slide for general dentistry, but a lot of general dentistry, like depending on the age group, it's more like periodontal diseases, SRPs. If you're working Medicaid population, a lot of extractions or root canals, but a lot of extractions, crowns, dentures, bridges. What kind of complaints do patients present with? Again, abscesses, patient care. It's just trying to make the kids feel comfortable in the chair. Actually, even when I work with geriatric patients, a lot of geriatric patients, the time they were in dentistry, they had no shocks, they had no anesthesia. So they would literally, like my patients told me that when they pulled my tooth, they didn't have anesthesia. So they were just traumatized. They didn't see the dentist for 10, 15, 20 years sometimes. And I know if you work for Aspen Dental, these big companies, they say that a lot too. Like your main demographic are patients who haven't seen the dentist in more than 10 plus years. So what kind of procedures do pediatric dentists or general dentists like myself who work in pediatrics? It's going to be under not just oxide sedation. Again, a lot of what's it called? It's very. I like pediatrics because only a few procedures you do: pulpotomies, stainless steel crowns. That's the main gist of it. And I work under general anesthesia too, a few times a month, where we work with the anesthesiologist who puts the patient to sleep, and you finish full mouth procedures. everything in one visit, which usually takes like 20, 30 minutes. But yeah, it's usually for like patients who are special needs. They can't sit down through a procedure for that long, you know, or they're definitely just not mindful, like they can't sit still. So you got to try to protect the oral health at an early age. Again, things are, I refer a lot to orthodontics. So pediatrics usually work hand in hand with orthodontics. And it's mainly growth and development is kind of looking out for what we can see. If they have a thumb sucking habit, if they, what's it called? If they have a small jaw, if they need an arch expander, because a lot of kids nowadays, what I'm seeing is that like they're usually adult front teeth come in at 6 years old, but I see patients 9 years old where not all their front teeth have come in, but their back teeth have, meaning they don't have enough space in their arch. And that can kind of prevent, you know, so that you should, the best time is you can use an expander, which can guide the bone to grow so the adult front teeth can come out, has enough space. Again, this is some instruments we use, stainless steel crowns, zirconia crowns for the front, or sometimes white crowns for the back. But I know a lot of dentists who work in pediatrics don't like using white zirconia crowns in the back because you have to shave off a lot of the enamel or the tooth structure. And we do a lot of extractions, again, depending on I work in Medicaid, and we'll look mix like probably 70%, 60% Medicaid. And a lot now is SDF treatment, which kind of arrests the cavities from growing. So focus on your goal and don't let anything stop you. So again, like my journey to dentistry was years. Working in the United States, I started in 2022. I'm a single dad with 2 kids, and I raised them by myself. So again, and I ran, you know, a company on the side while I was in dental school to make money on the side as well. So again, if you really want to be a dentist, if you really want to achieve your goals, you can. And again, like a W-2, because I know this is talked about a lot, and I do pretty decently out there. So never give up on your dream if you really want to be a dentist, but never do it for the money because you won't be happy. I know a lot of dentists who've been in it for 4 or 5 years already, and they want to do something else. So it's a toll on your back and body. You have to you have to love people too, because like you have to care about them, and that's when you realize like, oh, every day I'm making someone not hate the dentist. When I work in geriatrics or work in pediatrics, so that's why I really love it. It doesn't feel like work to me. So at this point, talk really fast. If anybody wants to ask any questions about maybe application, about like applying for dental school, or about what's like working as a general dentist or a pediatric dentist, I'm here for you. And let me know how I can help. You can also message in the text box. I think I have a few messages in the text box. Oh, Zoom link. Okay, there it is. Thank you. Okay. If there's no questions, that's fine too. Okay, so I'll wait a little bit if you'd like. I didn't take the DAT, but I help a lot of students take the DAT. I took the, for me, I had to take the IMBD. I had to take the national board exams. But from my understanding, I know a lot of people use those apps or like Dental Board Mastery, or what's it called? Like there's a lot of exam prepper courses that you took. And I know some of my traditional dental students who I helped get a dental school, they did that, and they had study groups where they would quiz each other every week about like certain topics. I know there's different topics there, right? If it's like more science type subjects. So I think that's the best way, because DAT scores I know is very important for your acceptance into dental school. What is one thing that helped you to understand dentistry in the U.S. as a student? As a student, actually, because I was lucky that I was born in a dentistry. My mom's a dentist, so she actually ran 3 dental offices in California, or actually 4 dental offices in California, and a huge network. But then what I would do is I'd work for different types of dentists, different offices. In my presentation, I was a multi-specialty assistant. So sometimes you can call up an office and just ask them, and like, don't be afraid of rejection, because I got rejected probably 10 times and got 1 yes. But then I was like, oh yes, someone said yes. So I'd call like every oral surgeon, every pediatric dentist, every periodontist. Can I shadow you? Can I shadow you? Corporate probably won't allow it, but those small private practices, if you reach out to them on LinkedIn, if you reach out to them on email, their phone call, their front office, or if you're really passionate about it, I would, I would go there directly to the office. Hey, I was wondering if I'm interested. Sorry, I got a phone call. Sorry. What's it called? I'm interested in becoming a dentist one day. I was wondering if I could shadow you and see what your office is about. And that's how I kind of got connected to working as a dental office manager, regional manager, and I kept getting promoted within. And that kind of gave me insight more on dentistry and why I wanted to do it. Because I see some students who think they want to be a dentist, but only shadowed for maybe a few, they shadowed just because they wanted to be a dentist, but then they realized when they got to dental school, they didn't want to do it. There's always a few students who drop out after the first first 2 semesters of first year. And 10 notes at the same time. Also, okay, so I was asked how to balance running attending dental school. It was hard. I slept like 4 hours a day, and I had 2 kids too, and I was a single dad. I got divorced during dental school. I know, and it's so funny. At UIC, there was like 4 or 5 divorces every year over there. I don't know if it's the school or anything, but I remember that. I had 2 kids, so for me, what motivated me the most, I have to, I have to support my family. Rent was expensive in Chicago. Not just that, I actually love what I do. So the side business I chose was like, I did it during COVID. I gave free presentations on how to interview, for example. And then a lot of my students got accepted to dental school. Like I have a 92% acceptance rate for all my clients. It's because I build these strong relations with them. Like some of them who are dentists now, we still talk and hang out to this day, and I help them get jobs. I help negotiate their contracts. Like, hey, you're only getting this much money? Let's negotiate it. Like, you've been working this long. So I worked with private equity groups to kind of change, what's it called, who took over dental practices and helped launch new de novo offices as well. I think that's cool. So yeah, I kind of run my own little side business through Instagram, and I don't really market. So it's just based on referrals, and I've been getting busier and busier every year. How many dental schools would you recommend applying to? I'm starting applications this year. I'm already a dentist in my country. Okay, so this is for foreign trained dentists. For foreign trained dentists, I recommend at least 10 dental schools. So at least just 10 gives you kind of a good what's it called? A good standpoint to be based on. And if you're like a U.S. citizen or green card holder, then there's like 5 schools that you can message me on Instagram if you'd like, or on Facebook, and I can kind of give you some of those schools that prefer those type of citizens. Did I start shadowing and then build the relationship to start assisting, or was it all together? For me personally, I started off as a dental assistant, and in California, all you need to do is pretty much have an X-ray license. X-ray license, and there's such a high need. You can see there's such a high need for DAs and RDAs all across the United States, that they'll give you a job with no experience. It won't be high pay, but at least you can see chairside exactly what the procedures are. You have to ask the right questions. So how do you treatment plan, or what are the type of cases you see on a daily, and see every dentist, if they're older or not, they kind of do their own thing. I know some general dentists who only do fillings and crowns. They don't do anything else. I know some who do everything. Some who mainly do implants now, and then it's a husband and wife or another dentist, and they're like an implant specialist of their own office type of thing. I mean, if you have the time for undergrad, you can maintain your grades. If you want to become a dental assistant before undergrad or in dental school, I had some classmates who were dental assistants on the weekend, Saturday and Sunday. So I've seen all. I know one guy. So if you think my running a business on the side and becoming a dental student, I had one person who was still a full-time police officer who worked after hours. He looked like he was about to pass out every single day, but he did it, and I didn't know how he did. But I was like, I don't know how this guy does it. Undergrad and dental school. So yeah, if you can, everybody's different. You know what I mean? I had 2 kids, so I couldn't work a full-time job at the same time. But I know a lot of students who are dental assistants full-time or part-time, or depending, because sometimes your schedule that semester is only 3 or 4 days a week, sometimes 5, depending on the university. Undergrad and work as a dental assistant. It depends on your experience. So you think it's a good idea to take a gap year after undergrad and work as a dental assistant? That was a direct message, so I don't think everyone saw this. A gap year, it depends on you. Again, if you think your profile is strong, I know some people who were in college and their undergrad, some of my students who were a research assistant. They worked at a dental office part-time for the past 4 years, or even 6 years in high school. They would do those ROP programs where they were a dental assistant in senior year. So that's why they had a lot of hours already. And they took their DAT early. So I know some people who are a little late bloomers who didn't have that much experience. So they took the gap year again to either shadow, work as a DA, get their RDA, get a lot of experience under their belt to kind of make their profile more impressive. I know some people, they went to the California Dental Association. You can take continuing education courses in dentistry to kind of understand it. So in your personal statements, for example, which are very important for any application, they can kind of say that, that you familiarize yourself with dentistry. Because number one question, especially if you have no experience, is going to say how do you know you actually want to be a dentist? You know what I mean? Show me a proof. Well, before I applied to dental school, I worked at an oral surgery office, pediatric office, periodontal office, endodontic office, and general dental office for about a year. Because I really want to know that this is what I want to do for the rest of my life. And when I know what I want to do it, I put my heart and soul into it. That's the type of student they want to see, not just my mom and dad's a dentist, so I did this. You know what I mean? So they want to know that you understand the difference between the specialties, that when general dentists can't, what's it called? When general dentists can't do a treatment, they refer to the specialty. Or I learned the correlation of diabetic patients and untreated diabetes to tooth loss and dentures. So that's why I say personal statements and supplemental questions are very important, guys. So make sure you don't take those lightly, okay? Because I know some students who were interviewed mainly with a bad profile on their personal statements. I know some for the community service or the letters of recommendation. I tell people the story all the time. I was accepted into Buffalo University in New York because for foreign dentists, we have to take a bench exam. I failed my bench. So they usually don't accept you. But then the dean of admissions, he actually said, hey, you know why I put you here today? It's like, well, you had great letters of recommendation. They said great things about you. So again, that's what community service, depending on the university, they favor some things rather than others. And I talk to a lot of professors who do the interviews or do admissions, and they tell me the same thing. Sometimes just one or two things on your profile that really catch their eye. It's something very that stands out. Do you have any advice for succeeding in dental school? Yeah, actually, people ask it, like my clients when they get into dental school, like, oh my God, I didn't know how hard it would be. Because again, it's like the first, there's some years, every dental school is different. Some have good work-life balance. I've heard great things about Loma Linda. Just because like I see them like every weekend, I see my classmate, or sorry, my friends posts, or like my clients posts, they're at Disneyland or they're at a party every single week. I was like, oh yeah, they don't believe in opening the dental clinic on weekends. Compared to my school, is the clinic is open nonstop, 7 days a week. Like you can work on your lab work all the time. So succeeding in dental school, honestly, just remember why you want to be a dentist. If you don't have a boyfriend or girlfriend yet, don't get one while you're in dental school or beforehand, okay? Because you're probably going to break up and you'll probably be stressed or depressed. But my biggest advice is time management. I did Google Calendar, and I color coded the most important things I got to do this week. You have so much exams. Sometimes you have 5 different exams in a week for like all your different topics. So what I would do is I would set a study schedule like 2 or 3 weeks beforehand, start reviewing my lecture from 3 weeks ago every single day onwards. So it's like I forgot the terminology for it. And I use the Pomodoro method as well, but definitely time management. Like if you're gonna do your laundry, do it once a week. If you're gonna meal prep. Anytime you can save time and be efficient, be efficient. The one thing I love the most and the least about being a dentist, I love being a dentist. I mean, like literally, I can't wait to go to work. If you see my Instagram stories, like I love motivating my team. I love the patients. The thing I love most is building those relationships with patients. Whether it was working in pediatrics now or working with geriatrics or any patients, is I love like if a patient was like super scared or fearful of the dentist, and you build that relationship, and they build your trust and they accept your treatment plan because they said that, okay, I trust you. Or a patient who went to 5 different dentists and no one wanted to see them, and I was able to see them. So I like being there for people at their most troubling times, or like I like relieving them of their pain. I feel like I do make an impact, especially with Medicaid kids, because not a lot of like I know patients who travel 4 hours just to see me because no other doctor would see this patient. That's the thing I love the most. The least thing about being a dentist, I have my neck pain. I mean, my neck hurts a lot. My posture is bad. Like literally for kids, sometimes even with loops or without loops, like they move around a lot, or like you have to kind of go like this. Even if I tell myself to go like that, it's just easier and faster because with kids, you have to work fast. So sometimes I forget my posture. That's my personal problem. I know a lot of doctors who have that. So chiropractor and massages is probably the least thing about being a dentist. Because honestly, most of the time for me, everyone's gonna tell you different things. I love being a dentist. I can't imagine myself doing anything else. I can still do a whole bunch of things after work. That's how much I feel like I think my work energizes me sometimes. What would you recommend someone do if they're starting shadowing and or assisting? What would you recommend someone to do? I mean, I would do more than just one, because I know some for me, like I remember with shadowing or assisting, when I work for one office, for me personally, I get bored. I learn fast. So after a week at the same place, 5 days straight, I already know what they're doing every day. Right. So and for me, I like hands-on. So I worked for Pacific Dental, and I didn't need anything for them. They just need experience, or sometimes not even. They're so desperate. So I was a traveling oral surgery assistant. So if there's these big DSOs, they're desperate for people. So I remember I traveled to different cities, or so I worked for like 4 or 5 different oral surgeons, and I see how they diagnose. So for me, that was awesome. It was interesting, and I got to see how they treatment plan, how they do sinus lifts, bone grafts, implants, same day. Like after an extraction, they do immediate implants. That was cool. But if I did the same exact general dentist who only does crowns every day, I'd be bored of it after a week. And sometimes, that's why I say shadow different people, because you might end up hating dentistry if you shadow the wrong person. My Instagram is acoustic dentist. I'll type it in the box. I don't know how to even, it says I'm still, everyone in meeting. Acoustic dentist. Okay. What would you recommend if you're starting to shadow or assist? Do you know what is required? In Canada, I'm not sure. Does this meeting give us shadowing hours? No, it doesn't give us shadowing hours. I'm sorry. But again, I don't know how what's it called? I don't know how it works in different cities or states, but you can just, what time you came in, but you can also message doctors or on LinkedIn or Instagram or Facebook or call them or visit them. That's how I got my dental assisting experience. I call if you're really passionate about it, find 20 places that can be rejected 20 times that week. The next week, another 10, 20 places, and they might say yes. So always try. How old were you in dental school? So if you saw my presentation, when I first started dental school, I was in the Philippines actually. I was 21 and I did that course. And then I started later again here in the United States. I was about 32. I was older, 31 or something like that. All right, good amount of questions, everybody. Is there anything else I can answer or ask about your profile or even being a dentist here? Great questions, everybody. Great questions. I don't know if I missed any. Thank you. Okay, you're very welcome, everybody. Again, my Instagram is Acoustic Dentist. If you want to follow me there, I don't really post as much as I used to, but again, I give advice on application consulting and all that. And I hope all you guys get into dental school if you really want to be a dentist, because we need more of you. And if you work in rural areas, always the better. They need you. Okay.
Thank you so much,
you,
Dr.
guys.
Deguzman. Your presentation was very informative today. And for the attendings, there will be a quiz that will be posted in the next 12 hours. Just look at our link tree or YouTube for one of those links. And yeah, thank you so much, Dr. Deguzman, today.
Thanks, guys. Have a great day.
All right.